Behcet's disease is a rare, long-lasting illness that can affect many parts of the body. One of the common problems is pain and swelling in the joints, especially the knees, elbows, and wrists. Think of the joints like tiny door hinges that sometimes get rusty and hard to move. When the disease is active, the hinges can become swollen, stiff, or painful, making everyday actions like climbing stairs or shaking hands uncomfortable. Explanation: the exact cause of Behcet's disease is unknown, but doctors think it is a mix of genetics and the immune system. Some people inherit a gene called HLA-B51 that makes them more likely to get the disease. The immune system, which normally protects us from germs, may mistakenly attack the body's own blood vessels, causing inflammation in the joints and other organs. Imagine a security guard that starts locking doors that should stay open. The body's guards attack its own tissues. Joint involvement shows up as pain, swelling, warmth, and stiffness that can come and go. The pain often feels like a dull ache that worsens after resting and improves with movement, similar to an old ankle that swells after a day of walking. Other symptoms may include ulcers in the mouth or genitals, eye redness, and skin spots. A person might say, "My knee feels like a balloon filled with water after I walk a few blocks," which indicates joint swelling. Doctors diagnose joint problems in Behcet's disease by looking at the whole picture. They ask about mouth sores, eye inflammation, skin lesions, and use a special set of criteria called the International Criteria for Behcet's disease. Blood tests can show inflammation, high ESR or CRP, but not a specific marker. Imaging like X-ray or ultrasound can show joint swelling. Treatment aims to calm the immune system. First-line drugs are colchicine or low-dose steroids. And if those don't work, stronger medicines called biologics, for example TNF-alpha inhibitors, are used. Think of it like turning down the heat on a stove that is set too high. The medication lowers the heat of inflammation. Because the exact trigger is not known, there is no guaranteed way to stop Behcet's disease from happening. However, people can lower flare-ups by avoiding known irritants such as smoking, stress, or infections, keeping a healthy diet, staying active with gentle joint-friendly exercises, and taking medicines exactly as prescribed. Imagine caring for a garden. Regular watering and weeding keep the plants healthy. Similar to regular follow-up visits and medication, keep the disease under control. Recent research focuses on the role of the gut microbiome and new biologic drugs. Small studies suggest that certain gut bacteria patterns may influence disease activity, so scientists are testing probiotic or diet interventions. Additionally, newer drugs that block interleukin-17, IL-17, or interleukin-12/23 are showing promise in reducing joint pain, without many side effects. Clinical trials are ongoing, and early results are encouraging, like discovering a new tool that can tighten the hinge without breaking it.